Namaskar everyone. My name is Dr. Manish Yadav and welcome to my channel. Welcome to this episode of Acute series. Already we have uploaded three videos about acutes and I have given a fair brief outline about how to manage acutes, what should be the approach in acutes, and the general guidelines and the philosophical backgrounds which will help you to address this issue. So today in this lecture, specifically what I'm going to talk about is I'm just going to brush up what I've already spoken about, and then I will share you some cases, 3 or 4 cases to elicit, to show you basically how this entire system works and how easily we can really, with the help of our repertory, mater medica, and the acute philosophy that Hahnemann has taught us, we can take help of all these factors and we can give some wonderful results in a very quick time. So let's go on a journey and let's come to the revision. A lot of things I'm speaking now is going to be little revision, but in a PPT format. So it's okay. So what is acute philosophy? We already spoke about this acute philosophy. Let us understand this acute philosophy again. Important points that we have to remember is the generals have to be in focus mode. Whenever you look for an acute case, the generalities, if you are following Kantinian method, then Kant always talks about looking for generals. And what does general mean? General symptoms are the physical generals, especially the thirst, the appetite, the sweating, the menses. So general symptom. Even mind also, you look for general symptoms, the thermals, the aggravations, modalities. So general symptoms you have to focus on, not particular symptom, not too much on particulars, but focus first on general symptoms. Particulars have no meaning in selection of remedies. Remember this point. In Kant repertory also, we find a general rubric. Like suppose we find anxiety, and then we have got daytime, nighttime, with thirst and this and that. All those things are there. Sub rubrics are there. These are particulars. Okay. But when you read Kant's lesser writing, Kant specifically talks about that in selection. Remember this. In selection of a remedy, generals are more important than particulars. Particular loses its value if general symptoms match. So you have to always look for general rubric, that is a bigger rubric which has got bigger range of remedies. So particulars has no meaning. Yes, it has no meaning, but it can have a meaning. Suppose you get a sub rubric and there is a single remedy or there are 2 or 3 remedies. It has a meaning when you go and read mater medica and mater medica confirms the selection of remedy. Then only that particular rubric has some meaning. So otherwise, when you form a totality, look for adding more general symptoms or general rubrics that will help you to give a group of remedies. Remember this, repertory is not a tool to find a remedy. Repertory is not a tool to find a remedy. Repertory is a tool to come to a group of remedy. And then from that group of remedy, based on your mater medica knowledge, you have to select 1 or 2 remedies. Out of those 5-10 remedies, you have to select 1 remedy. More general, when we're talking about rubrics, which rubrics has to be taken? More general and exciting cause rubrics has to be taken. So now we are coming again to the back to the philosophy. Now, when you are, like I'll give you an example. Repertory is what? Repertory, our practice, especially the people from our side, our practice is majorly depending on repertory. Whatever data repertory is going to give, our analysis and differentiation are going to be hooked to that group of remedies. But remember this, that repertory is not human. It doesn't have any intelligence. It is just a software. So when you feed, whatever you feed, it's going to come back. Garbage you put, garbage will come back. Good things you put, good things that will come back. So when you put the rubrics, who is putting the rubrics? Who is adding the rubrics? The person, the homeopath. He's the most important part. His brain and his thinking is more. So you have to be very careful. I keep telling this to my students that be very careful when you add any rubric. So don't be very quick in taking the rubrics from here and there and whatever you feel like. No, take proper symptoms, the symptoms which you know that is going to be used for selection of remedy or it matches my philosophy. Take only those rubrics. So what are other rubrics that you should focus on? More general rubrics and of course the exciting cause rubrics. The cause that we have talked about in earlier lectures, I hope you must have gone through my earlier lectures where I've extensively spoken about the cause. For as number 5, Hahnemann talks about acute disease, you have to look for exciting cause. So those exciting cause rubrics, once you have elicited the exciting cause, then those rubrics has to be there into the practice, into the repertory. You can find the rubrics in Kent, BBCR, maybe in FATA, Boric, that's depend on your choice. Don't repertorize, very important. Don't repertorize everything what patient says. Now, when patient comes in acute, he will say a lot of things, lot of things. I've got pain here, I've got this, I've got that. Don't try to just repertorize and put symptoms into rubrics because he's telling some. Because if you do this, this is called mechanical way of repertorization. There's something called as artistic way of repertorization. So what is artistic way of repertorizing? Where you think and you put the most important and characteristic symptoms into the sheet. So don't repertorize everything what patients say. Now coming to the philosophy, what's the philosophy? Exciting cause. What Hahnemann says, look for the exciting cause. What does it mean? It means the onset and location, sensation, modality. These things are there. But even before the location, sensation, modality, onset. This question is the most important question. And here lies the artistic value of homeopathy. Homeopathy is science and art. This is the art. Science, it is proven that you give right remedy, patient is going to get better. But what is an art? Art is to elicit how you can go and elicit the onset. So first you have to get in your mind that no acutes, the real acutes, I'm not talking about the indisposition, okay? Indisposition doesn't need any remedy. But real acute cannot happen without a cause. There has to be some cause. If there is no cause, then it is very difficult to say that a patient got fever, cold, cough, colic, and there was no cause. Now, it is your job, it is your skill that you go behind, go behind, go behind. Okay, what you did yesterday, what you did yesterday, where were you yesterday, night, where were you? You just keep going and asking everything, all permutation and combinations. You take the patient from his present complaint to the later part. So remember this, exciting cause. And then, of course, onset after onset. Onset means how does it start? There are symptoms. It starts gradually. It starts gradually, suddenly. How it started and where it's from. And next, of course, location, sensation, modality, concomitant. We have learned this many times, but sometimes we also forget. So location, there are different parts of the body. In acutes, what is being affected? Muscles are affected, bones are affected, nerves are affected, mucous membranes are affected, head, liver, spleen, urinary tract, stomach, genitals. What is affected? Menses, uterus. What is affected? So that location is very crucial. Important question. Now, how are you going to ask about the onset and exciting cause? The important question that you can ask is since when? So when patient comes, suppose, okay, let me give an example. So the patient comes and says, I've got fever, I've got coryza, I've got this body pain, body pain. Remember, when patient is going to come and sit in front of you, he's only and only going to talk about his present predominant totality. It's not even dominant, present complaints. Because patient has come to you for the trouble, the discomfort. So he's only going to talk about the discomfort. He's going to talk about the pain. He's going to talk about the burning. He's going to talk about the other aspects of it, weakness, restlessness, all those things. And you can ask that these things are not important. It is important, but it is secondary. It is secondary. First, you go back and ask, okay, I understand your problem. I understand you have pain. I understand you have burning. But my dear friend, how did it start? Since when? So first question you can ask, since when you're having this? So he will say, oh, since today morning. Oh, no. At night, a little bit the pain had already started. No, I'm suffering this from 3 days. Since when? So when he says since when, how did it start? Then the question is, how did it start? Suppose he says, it started yesterday night. Then the next question should be, okay, how did it start? It started gradually, suddenly. Where were you? You were in your house, you were outside, you were traveling, you ate something, you were exposed to hot, cold, where were you? And then you will get out. And then he's going to say, so it's a artistic means what? You have to take the patient mind from his present totality, like his present state, to the backyard, backwards. So, and then he will remember and say, no, no, doctor, actually, in the night, I had gone, evening, I had gone somewhere out and we had a party. And then, we watched a movie, it was chilled. And then what he did there, I drank cold drink, Coca-Cola or something. Or you might say, oh, that day, whole day I was traveling, I'm in sales, I was traveling. I was a climate was very hot, and I was feeling so hot. And wherever I was stopping, I was just drinking cold water, or I work too much. Or he will say, no, doctor, actually, what happened is that since 3, 4 days, I've been suffering from little migraine or headache. A lot of night watching is happening. There's a lot of pressure in my office. Whole night, I'm just getting 3 to 4 hours sleep. Too much thinking. Right? This is how you will get. Or he will say, I went out, I ate Chinese, I ate this, I had cakes and pastries and this and that. So when you will ask proper question, then his mind will go and then he will understand that what my doctor needs. Again, the same thing. What was there before this? So he says, oh, you started evening. What was there before this? So I told you where you were, outside, inside, all the situations, all the areas you have to explore. Remember, when patient comes to you, concentrate on circumstances, weather, time, then what he tells. Means when patient is coming to you, his focus is his discomfort, as I told. But your focus should not be his discomfort first. Your focus has to be you go back and focus on the climate, weather, circumstances, the time. How did it start? Where did it start? What happened? What he was exposed to? All those things. And these things has to be taken and put into repertory. In the previous slide, when I was talking about repertory, I said take general symptoms and exciting symptoms. These are, so when you go, you will get, okay, wet, getting wet, hot exposed to, eating fatty rich food or a lot of fats, eating outside food, having cold milk, having, cold drinks, or too much mental exertion, too much physical exertion. So those symptoms has to be your important symptom or high grade symptoms in your record. Okay. Learn and remember the bold and the italics. I think this slide you should make a paper and stuck up in the wall of your clinic somewhere. Learn and remember the bold and the italics. This is what I learned from my teachers, and of course I learned this from my teacher, like Sarkar sir taught me this, and Gajanan sir, and not many others, but Gupta sir, I always talk about him because I have to give him the credit. He was a person, Dinesh Gupta from UP Azamgarh. He is the person who actually emphasized this so much in my brain that it has revolutionized my practice. And today, every case I will look for the italics and the bolds. So once you have formed a totality, whatever his physical generals, the location and this and that, how do you find out a remedy? Is you have to first and foremost, the remedy that you are thinking of and the symptoms that you're thinking of could be the cause. Those things, the general symptom or the exciting cause symptoms, has to be written in bold, italics, or at least in one line in your Mathematica, especially Boric or Alice. It can be other books also, but basic book line is Boric and Alice. So always, remember my friends, always before giving a remedy, you open your Mathematica. Even if you have to give alconite, please open. Arsenic, open and see the symptoms. On the symptoms that you want to prescribe, you have to open your books and read. Because once you read, once you find it in your book, and then your remedy has to act. And if it is not matching, whether it is covering all the rubrics, if it is not matching in Mathematica, you discard the remedy. Go for another one and try and find it. Don't give a remedy just because it covers the entire totality. Totality can be misleading because it all depends on the intelligence of the physician, what he has taken and what he has put inside, right? So remember this, and I will be speaking about this many times in my cases. I'll show you practically also I do it, but remember this very important point. To summarize, acute disease, look for exciting cause, The physical constitution, yes, it is also very crucial that physical constitution is so important. What does it do? There are many remedies which work on the physical constitution. The occupation, how many times we really ask about the occupation? Person is working in IT, person is working in centralized AC, person is his occupation is about working in the field, his occupation is exposed to a lot of smoke and dirt. So this occupation will also help you to understand the cause of his disease. Social and domestic environment. Where does he stay? Which which environment he stay? What is the domestic environment in the sense in his family? How are things? Conflicts? Yes, no. Then you get the mental cause of insulin. Warning us an acute approach. This is very crucial. Location. You look for sensation, modality, and comfort. Now listen to this carefully. We have heard this many times. Location, sensation, modality, and concomitant. And everybody knows the importance of it. You have to look for all those four things. And out of those four things, which one is the most important? So remember this. Sensation is abstract. You can't rely on it. But you can definitely rely on other factors like location especially. So don't worry about sensation too much in acutes, especially in acutes. Patient is having pricking pain or stitching pain or needling pain. It is so tough to describe. I don't know how provers have described and how the person who are taking the symptoms have described. So don't worry about the sensation until it is very clear. If there is some doubt, sensation is own people's understanding and in the language that they're comfortable. Every sensation is defined in different words. And what they say, what you understand is absolutely difficult. So don't worry about sensation. Okay, it is abstract. So don't rely on that. The most important factor in acute is the location, as I said, modality. The most important is modality. After location, the another thing is because in modality, patient cannot lie you modality. He cannot lie about modality, whatever happens. If he is aggravated by getting wet, he's good. If he's aggravated by cold draft, it is aggravated. If he's ameliorated by rubbing, he is ameliorated by rubbing. There is nothing to interpret. Any system which teaches you to interpret and think too much, okay, I think you should remain away from it. The system which teaches you to remain more grounded, less interpretation. That's what Hanuman said. Less interpretation. In fact, there should be no interpretation. You just take pure symptoms, hepatitis, look into mathematical and so modality. And yes, look for concomitants. Patient can't lie concomitant also. Best and in fevers, especially in fever, the best concomitant is the thirst. Thirst for cold water, thirst during chill, thirst during. We will talk about fevers in some other session, but remember about thirst. Always ask about thirst. I have written here in fevers, but even in other things also you have to ask about thirst because in general symptom, appetite and thirst, these are the two things. Forget about appetite, but thirst is something which alters very. Patient become thirstless, thirsty, craving for cold being, hot, sour, so many things happen to thirst. And concomitant, if you get really proper concomitant, PBCR can help you and you can surely rely on this and give a very fast relief. So now I will share you some cases. I'm not going to show you PPT cases. I'm going to share you some oral cases because it's an open platform. I can't show you the audio and video. Every day, almost every day, acute keep coming and going. And I'm so happy. I'm so happy that it is thrilling actually, to solve acute cases. It takes a lot of guts, it takes a lot of courage, but I think that's homeopathy. When you can treat acutes, your confidence increases. And even in pathological cases also, it is the acutes only that you have to manage a lot. It's not just to give a remedy and relax and sit. No, patient will call you for acutes. Remember, when the entire family starts calling you for any acutes happening in their family, you understand that you're really doing good as a whole. Because that is our agenda. That is our goal, that people should call homeopaths for acutes also. Homeopathy is not slow. Homeopathy is very fast. It acts so fast that not even allopathic doctors can think about it. But the only thing is, the problem is not homeopathy. Problem is homeopathy. Okay. So let me share you a few cases. I'll share you 4 cases, 3 or 4 cases. So once what happened is that I got a call from my uncle from North. It was in April or May, not May, but it was in between that time. I'm telling you the time because that's important, right? So he called me and he said that, Beta, I'm having a lot of coryza. Okay, coryza. I said, okay. And what is happening? So coryza is there. Also, today I've started feeling little body ache and fever is coming. Slowly, gradually, fever is coming. But this coryza is too much and I'm feeling very weak, drowsy, this and this. So he was talking about his symptoms. And I asked him, okay, tell me, how did it start? So he said, no, it just started. Remember, whenever you will ask, how did it start? They will always say, no, it just started. I said, no. When it started? He said, Beta, I'm having this since yesterday, little coryza, but today it became very bad. I said, okay. So I said, where were you yesterday evening? Where were you? He said, actually, I'm at home only, but since 3 4 days, I'm going on the field. He's a farmer. He says, but since 3 4 days, I'm going on a farm and I'm doing some work there. It is not that heavy work, but almost I'm spending 3 to 4 hours there. I said, from what time to what time you're spending? This is from around 9 o'clock or something. I go till 11 o'clock, 12 o'clock, I'm there. And I said, then what do you do? And he said, I come back and that's it. This is what I'm doing. Now it's April and May in North. It is very hot, right? Climate. You got the cause, right? It's very hot. So I asked him, how's the climate there? He said, it is very hot now. In 3 4 days, it is so hot. And I said, why do you go in the hot and you do that work? He said, no, there's some work. I said, 3 4 days only I'm going, but it is very hot. Like a lot of sun, direct sun is there. And the first remedy I was thinking was brownie. Why? Because hot climate. So I asked him, it's no problem of thinking remedies, right? I asked him, so what do you do after you come from hot? What do you do? I asked him directly. It's not advisable, but I asked him. He said, yeah, I come and then I drink water or I drink mattha, chas, buttermilk, basically. And I started thinking about bryonia because bryonia has this cause, chilled when overheated. So when you want to give bryonia, the generals also has to match. It's not just the exciting cause, but general also has to be. Then if you want to give bryonia, there has to be body ache, dryness, a lot of thirst. This is very important. And there are, of course, some mental symptoms and general symptoms, but these 3 things are very important. So I asked him, what about your thirst? He said, Arey beta, since I have got this sardi coryza, my thirst is absolutely gone. I said, what? Now that is contraindication for bryonia, right? Bryonia has to be thirsty. I said, what are you saying? He said, yeah, I'm thirstless. I don't feel like drinking water because this coryza has happened. Since coryza has happened, I just don't feel like drinking water. Before that, I was drinking a lot. And then I started doubting my remedy. I said, no, there's something else. Then again, I asked him, so tell me, uncle, when you are in the hot weather, you come and then you directly drink the water? And then he confirmed, no, but I don't do that. I go, I work, and then I come. After a while, I become cool, then I drink. And I thought, no, my bryonia is wrong remedy. I have to think of something else. Now, what I got 2 things here. Definitely, there's a cause of getting overheated, cause of being sun exposed. So I need a remedy. I know now. I know the cause, right? I know that I need a remedy which has got something to do with sun, something to do with heat, something to do with overheated. Now you can think of antimony crude, you can think of bryonia. There are so many other remedies also. So I got the cause. Okay. Now I will look for general solution. So again, I asked him, what about your thirst, appetite, and again he repeated the same thing. But since the coryza, I've got thirsty. I've become thirstless. So what is the symptom? This is a concomitant symptom. So coryza came with coryza. What happened? Thirstless. So different symptom coming at the same time. So let me go. Which repertory? Yeah. So repertory is body also. So let me go to the body faucet. Just give me 2 minutes. When you go to body faucet, I'll open nose chapter. I'll go into Riza. And when you go into Riza, it's a concomitant. So I look for concomitant for Riza. The remedy called. We have got rubrics. You can see here. Thirst and thirstless. When you see thirstless, that is natrum carbonicum. And once I saw this, oh my God, what I did, I know natrum carb, but what I will do, as I said, every time before giving remedy, I will read. So I went and I read. All natrum stimulate cellular activity, oxidation, metabolism, great debility caused by summer's heat. What did I say? Bold in the italics has to match. So natrum carb, what is the cause and the most important symptom or exciting cause of natrum carb or aggravation of natrum carb is summer's heat. Chronic effects of sunstroke, exhaustion, and then of course other things follow. I do went and checked the nose section also. You can see catarrh, bad smell, post nasal discharge. I did not confirm these things because I got these two things and I got this bold in the italics, I matched. And it was a wonderful relief, wonderful relief. Within 2 doses, not I couldn't give 1M. I should have given 1M because everything was matching. So potency, if anybody has doubt, I have uploaded a video for potency also, you can look for. So in this case, ideally, I would have given 1M because it was in village, so only 200 was available. I gave 200. Within 2 or 3 doses by evening, he was absolutely fine. His fever also went, his coryza also went, and he started working again in the field, and things were great. So this is how you look for cause. Next case. Now, I've got this remedy which I'm going to talk about. I've got many cases like this, but I will share you one very nice case which I got during the COVID times. So what happens? It is just after the first COVID has opened and after 3-4 months after that, and I just started my new clinic in Mira Road at that time. So I got a patient, some relatives sent me a patient. Now this is not it is a chronic case, but I treated it as an acute. So he came to me and he was having diarrhea. He was having continuous loose stools. And these loose stools were happening since around 2 months. I've got a recorded case of this, right? Follow up with this. All the cases that I'm talking, I've got all documented. I have all before and after audio, video, everything I've got. So talking all facts. So this patient came to me and he said, I've been having loose stools since 2 months. And this is troubling me a lot. I've been showing it to many doctors. I've done scans, I've done sonography, everything I've done. There's no cause. And I've exhausted all doctors, gastroenterologists. They're giving me medicines, but it is not getting better. The stools keep on coming, even after taking so much medicines. Even today also, 3 to 4 times, sometimes it becomes 5 times. I have to keep going on for stool and lose motion. Now this is his presenting complaint, right? Lose motion. So what I can do is that number one thing is I can go deep. I can ask about how is the stool, the character of stool, what is the complaint, the concomitant, the general symptom. Yes, that is absolutely fine. But I said, tell me one thing. I will ask about your discomfort. But tell me, how did it start? 2 months before, where were you? Suddenly, your health was good. Then suddenly, how did it start? Where were you? Where you had went? You went outside. You got. I tell this patient, you got exposed to heat, cold, water, contamination. You ate something. You're out party. Where were you? And he said, actually, doctor, after first COVID open, lockdown open, hotels open. So my friends, we have a group, and I am a pure vegetarian, and basically I don't drink. So they all went in a club, for a party, and everybody was boozing. So I had no option but to eat the starter. So I ordered paneer, so dried paneer. And he said the paneer, after a long time I was eating because in lockdown, outside food was off. First lockdown had opened. That paneer was very tasty. And all the people are drinking. I don't drink. So I had only option to eat. That paneer was so tasty. I actually kept eating. I ordered one more plate. And I think, doctor, after that only, as I came home, something happened in my stomach. And next morning also it happened. So that paneer, I think, overeaten of paneer. I said, really? He said, yeah. And then only one thing I had to ask. So I got a cause. What is the cause? Cause is eating fatty food. Any fatty food that he has eaten. That was the cause. Now, which are the remedies for fatty food? You can go and check. The number one, the first remedy that you should think of is pulsatilla. Yeah. A lot of people have messaged. Yeah, very nice. So pulsatilla is the first remedy that you should think of. There could be other remedies also. Fat aggravates. You can go and use Clark repertory. You can look for Allen's Matremedica. There could be more remedies also. But specifically when it talks about fatty food, pernicious foods, cakes, pastries, chocolates, the first remedy you think of is pulsatilla. And I've cured many babies, many children's pediatrics with pulsatilla on this symptom only. So just I asked, what about your thirst? He said, I'm thirstless. I said, in the entire day, when the complaint increases, so now I'm looking for general symptom. He says, every day is okay, but evening time, now, evening night when comes, my trouble increase. So I got thirstlessness, I got evening aggravates, and the most important cause I got is fatty food aggravates. So pulsatilla was the remedy. And within few doses of pulsatilla, within 1 week, the follow-up came, and he was absolutely fine. Now it's been like 2024. I'm recording this video. It's been more than 2 years, and the patient has not suffered from diarrhea at all. And so many patients he has referred to me, I can't tell you. Right? So that's the importance of knowing the cause, going back and finding out. You can take help of your repertory, you can take help of your mathematics. So food item. Great. Now I'll tell you another case, heat aggravates case. Now this is a case of a patient who came to me. He was a security guard. I was working in my Andheri clinic at that time, and a security guard came to me. This is the old case, but I'm trying to connect it. Like earlier, what I used to do, and if you would have come to me now, that time I took the case for at least half an hour. Okay, but now I would have just finished within 5 to 10 minutes. This patient came to me and he was literally chilling. I have his video, his new case video and follow-up video. This patient was literally chilling. He was having chills, tigers, and a lot of heat was there. So what I did is I was taking all the symptoms. I took all the symptoms as we are taught in fever. Chill before, chill during, chill after, fever before, everything I took. I repertorized. With a lot of effort, I repertorized. What happened? A lot of remedies came. So again, I'm scratching my head, confused. And then I asked him, tell me, how did it start? Tell me how. This I'm telling my old case. So I wouldn't have taken so much time now. But then also, to just differentiate, I asked him. So tell me, from when this complaint is there, you're having chill. He said, doctor, since yesterday night and evening, I'm having this. So I took allopathy, but now allopathy is also not helping. And so morning I came to the office, but the chill is too much. He said, yesterday night, evening, what happened? Where were you? He said, no, I had actually gone to play cricket. It was a holiday. So I went to play cricket. I said, what did you do in the cricket? He said, nothing. I played and it was very hot. And I said, then what you did? I said, I was drinking water continuously. There was a cold water, chilled water I was drinking. So I played and came back and drank cold water. And after that only, I started feeling a little lethargy. And when I came home, then this fever and things happened. I went to the doctor, took medicine, and now also I'm getting changed. So what I got, the cause is, so of course the remedy is bryonia. So I confirm. So let us see bryonia. First, let us see bryonia, what is written. So in this case, let us open bryonia. So we go to bryonia, we go to Allen's schema, and let's open up elements. Complaints. Listen to me. What is written in bold and italics or underline? So after taking cold or getting hot in summer, Complains when warm weather sets in after cold days, from cold drinks, ice in hot weather. So hot weather, lot of people drink here in Mumbai. A lot of people drink sugarcane juice, and it is hot, right? And especially in summer, this somehow sugarcane juice. Every 500 meters, you will find one sugarcane juice. People are drinking like water, like water, and they want a lot of ice into it. So after drinking that, also people get disease. So Brahnia could be one of the remedies. So now look at it. When warm weather sets in after cold days, from cold drinks or ice in hot weather, what is underlined? After taking cold or getting hot in summer. So getting hot, overheated. I showed you a case of natrum ka. Okay, this is another remedy. Antimony crude is another remedy. From chilling when overheated. So you are overheated and suddenly you get chilled. Now you have to think, what are the ways? When you read material medical, you have to think, how can a person get chilled when overheated? Think about it. So maybe, he's hot and he came home, he drank ice water directly from the fridge. Or he was very hot and he entered and he started the AC or he entered a room which was actually chilled. So these are the ways. Exposure to draft, cold wind, and some other things. Right? Now, if you open, okay, so that was enough. In fact, that was enough. What else I had to confirm was for the thirst. So, what do you think? How the thirst has to be? He was very thirsty. Look at his tongue; it was coated. These 3-4 symptoms were enough to prescribe. I gave remedy Brahania. I gave 1 and I just had a call after 15-20 minutes or maybe 30 minutes after he came back. And within 15-20 minutes, sweating started. A lot of sweat came and he felt good. And the last sentence that he told me, actually, he was telling me the same thing again in his office also. When I was taking his case, he was telling me, please give me some medicine so that I can go home. I can go home. I can go home. And once he got better, he said, I want to go home, doctor. I want to go home. So going home is also an important part of Brahania. Now you can connect all the mental symptoms, going wants to go home, disturb averse to, those things are there. But once you get your exciting cause right, I tell you, life becomes very easy. This is the secret of managing acutes, and this is how you can quickly help patients. You don't need some fancy remedies. You don't need some crazy remedies. Your simple polyquest remedies, if you learn properly from Allens and Boric, you learn every remedy. I tell this to my students, and this is how I also do it. Every remedy, when you read, you generally read the symptoms of the remedy. Right? Okay, Pulsatilla has this, Brahnia has this. Read that, which is crucial. But first question you should ask when you're reading a remedy, how does Pulsatilla become ill? Like what makes Pulsatilla ill? What makes Rustox ill? What is the evolution of disease in this? Sambucus nigra. How does this nose block and this come? Ammonium carb. What is the thing which causes nose obstruction? Savadilla. What is the thing which causes this sneezing and allergy? Cause. Exciting cause. The evolution of disease. In this terms, when you will read your Materia Medica from Boric, Allen, Kent, Clark, Tyler, I tell you, your knowledge will increase and it will be very easy for you to spot the case and give a remedy very quickly. Okay. So we did 3 cases. We did natrum ka, we did Pulsatilla, we did Brahania. One last case we will do and then we will wind it up. Now this patient also came to me. I'm specifically talking about drinking and eating. Now this patient came to me. He was having cough for 15 years. How many years? 15 years. On and off, he was having. He was given, just for cough only, he was given anti-tubercular treatment also, which they stopped because they realized that it was a wrong treatment. Always used to take antibiotics. He came and he sat in front of me and he started telling that I get this cough. This cough is bothering me. I have respiration difficulty, this, that. I told him only one. I said, don't tell me what is happening to you right now, your discomforts. Tell me, how did it start and since when it has happened? So he says, I'm having this for more than 10 to 15 years. I said, okay, tell me, when was the first time you got this and how did it start? So he went back and said, I was in my village and I had got fever. I was treated for fever, and fever went off. But after that, this cough remained, and then cough and cough and cough and cough continued. I said, "How did you got fever?" He said, "Actually, I had been for a marriage. It was very hot climate. I came back home in the morning around 11 o'clock or something, or 12 o'clock. And there was nobody at home. My home parents were not there. They had gone somewhere else. So it was very hot. So what I did is I went and the tube well water, I took a bath from it. It is very cold. So I just took a bath from tube well water. But I was also feeling very hungry and there was nothing to eat. There was buttermilk, matha. Buttermilk was there. So I took one big jar of buttermilk and I drank. Ah, I felt so nice. I was already tired. So slept at around 1 o'clock or 2 o'clock or something. And by 4 o'clock, I was in sleep only and I was shivering. I got heat, fever, this. So what happened now? And then, of course, his treatment started. What happened now? What did he do? So he was hot. He came home. It was very hot. And then suddenly he went and he dashed water on it, cold water. The tube well water is so cold, so cold. So he dashed water into him. What happened inside? Think about what happened. There was sudden change in the temperature inside the body. Body was very hot and suddenly it became cold. Sudden change from hot to cold. Another thing what he did is he drank cold drink. So cold, taking cold, very cold. And what are the symptoms in the cough that he was having? He said it is not just cough. There's a lot of mucus discharge. I get sneezing. I get coryza. So what is affected now? In earlier case, it was fever, body ache, and this and that, pneumonia. But here, what is happening? Hot and sudden change. Sudden change. Sudden. And what is the affection, like location, where the sphere of action is? On the nose, on the coryza, on the discharges happening. So I need a remedy which gets chilled or sudden change in temperature in the body, getting chilled from overheated or something like that, taking cold and hot weather. And affection is not bones and the muscles, affection is mucus. So the remedy that I gave, it cured within 15 days after follow when he came, it completely cured him. His 15 years of cough, coryza, it went off. I did not take the case ahead. I did not ask anything. His nature, his mind, nothing. I said, here is the disease, here is the cause. I got the sphere of action, the body where it is affected. Why do I have to go into thematics and break my head in his head? If I don't get anything, then I will go deep. And it completely cured. Till today, sometime whatever happens, he keeps calling here and there, but he's absolutely fine. Absolutely fine. So what is the remedy? Remedy is, you can message right now, yeah, some people have it. Delcamar. The remedy is Delcamar. So let's open Delcamar. So my dear friends, what I'm trying to do is that not just teach you acute management, but I'm teaching you the remedies also. So look at here. Catarrh rheumatism or skin affection. So the word important is catarrh, means whether it is bones or it is skin, the mucous membrane is there. So there will be a lot of discharges wherever it is affected. Brought on or aggravated by exposure to cold, damp, rainy weather, or sudden change in hot weather. Now this is very crucial. So Dalkamara comes very close to Rastos, okay, where you get exposed to rain, you get wet after bathing. Complaint comes rainy weather. But also there is not cold weather, cold draft. There's like nose coryza, exposed to cold draft and sneezing and coryza happens. Dalkamara is a remedy. But remember this, what is written here? What is written here? Sudden changes. He could have written changes, right? He could have written exposed. He could have written chilled, like in Brandy it is written chilled when overheated. Say sudden changes. So in the body, when you read Dalkamara deeply, you'll understand in the body, when body is at one temperature and suddenly there is a change and it goes to another temperature, then the remedy is Dalkamara. And of course, your DD differential is Brandy. So Brandy and Dalkamara will be very close. But now you know how to differentiate. Brandy will have uh, musculoskeletal affections, the thirst, the mentals, and Dalkamara is more of rheumatism, but it is all of Qatar. Qatar is very okay, sudden change. And then, of course, this one symptom I want to show you. Patient living in working in damp, cold basement or milk dairy. What is milk dairy? Means what? Patients who are living in some area where they are continuously exposed to water. Their feet are in water. Even the people who are working in some places where they're continuously exposed to water, water. Like natrum sulf, arsenic, arenia diadema. So these are the things which cause problem to Dalkamara. I want to show you something in Dalkamara. Let's go to yeah, Dalkamara. Let's see this. In abdomen boric, if you see, it is written colic from cold. Colic from cold. I had given one of my patient, he got diarrhea actually. He had diarrhea, a lot of diarrhea. I just remembered a case. A lot of diarrhea. He called me and said, I've got diarrhea, loose stool, this and that. I asked him only one thing. When did you went? What did you do? He said, I was out. It is hot climate or something. Climate is okay, but what I did is that I went through bike and I drank cold drink, thumbs up or Coca-Cola. After that, this happened. So taking cold, suddenly, changing your body temperature and diarrhea happened. And a lot of pain was there. Dalkamara few doses completely cured. So colic from cold. Now, when you go and read every uh, affections, like stool, urine, you will find something to do with chilled. See this, urine. Must urinate when gets chilled. A female, everywhere you'll get something to do with coldness, dampness, getting chilled. Okay. After getting cold and wet, back pain, extremity, feet, icy colds. Right. So that's how you can go and read the remedies. So, my dear friends, this is the end of this topic, and I just tried to help you with the cases and the philosophy background. And in the next lectures, I will come up with some more sessions. Like I will talk about colics, I'll talk about fevers, and maybe I'll talk about the remedies like summer, winter, and rainy weather remedies. But remember the initial part which I said, it is very easy to manage acutes. It's not that tough. It looks tough, but it is not tough. If you keep your groundings very sure, you keep your philosophy very sure, and you follow Hahnemann and the classical people, you become the master of acute management. So remember everything what I shared, what the exciting cause, the location, sensation I told you, the modality concomitant, and generals. Look for generals. What is the change in the general? It can be a very nice guide to, find a remedy. So please write to me in the comment box, whatever your questions are there, or how do you like this session? And definitely we'll come back soon again. Thank you.